We have a panel discussion now on AI in healthcare, and Inspired Minds launched the largest global summit focusing specifically on the use of AI in medicine and healthcare. And we had a fantastic conversation over a few days in Basel in Switzerland last month. And there we had a unique ecosystem of clinicians, technologists, hospital heads, C-suite executives, all joined together to discuss how AI will revolutionize healthcare and answer a lot of questions about preventing and providing solutions about some of the world's greatest healthcare problems. So we're really pleased to say that following on from that, we've got the next panel discussion, sharing the work in the field and learning in particular. So to moderate this session, I'd like to invite on stage, including the panelists, our moderator, Alexander Verleysen, GP and co-founder of Nye and Dole Fellow at Oxford University.
Brilliant. I'm Alexander. I'm actually a primary care doctor, and I feel like it'd be remiss of me not to encourage people to do a little bit of exercise. So if you can stand up from your chair, and if you can't stand up from your chair, you can just shake in your chair. Everyone get a little bit activated. Then you can sit yourself down again and probably get a few extra steps on your watch to feel better if you need the AI part. Brilliant. I hope everyone's feeling invigorated. Steve Jobs just had to make stuff that we all wanted, but in healthcare, unfortunately, we have to make stuff that does people good, which is kind of what we're here to talk about now. I'd like just to introduce each of the panelists, and maybe just start with you, Hila, if you could tell us a bit about yourself and what you've been doing with Ada.
Absolutely. Thank you so much for having me. Yeah, at Ada Health, we try to help people all around the world to manage and understand their own health. Basically, we do this through an interactive chatbot that we've developed over the past 7 years. Initially set out as clinical decision support for doctors, but we've launched an app now for individuals all around the world where you can really try to help to assess your symptoms. So instead of Googling your symptoms, which we all know is very confusing most of the times, Ada is doing a structured, personalized health assessment, trying to guide you like what your possible condition could be, what could be the disease, and then also guide you what next step you can take. And what I'm specifically working on and what we've launched actually today is our Global Health Initiative. So we look specifically into how can we use our technology, our app, to increase access in low and middle income countries for vulnerable populations worldwide to healthcare, essentially. And this is one of the aspects that is quite crucial here is to take into account that there's a huge shortage of doctors worldwide, and basically how can we use a scalable solution that is based on mobile technology to increase healthcare for millions of people all around the world. And currently we see already we have 5 million users all around the world that are using Ada, and half of those are in low and middle income countries. And one of the next steps with this initiative that we've partnered up together with the Botnar Foundation as well is to see how can we integrate our technology as an integral part of the health system.
Brilliant. So I guess that frames for us the challenge in healthcare is really twofold. One, there is a knowledge problem. People die because of stuff we don't yet know. And another problem is the implementation problem. We know how to do stuff, but we're not yet doing it. And those both seem like problems that potentially artificial intelligence has the capability to fix. And in a sense, you're laying roads to create new knowledge, and you're also attempting through technology to close some of the implementation gap. Brilliant. We'll come back to that in a moment. Bart, if you could introduce yourself, that'd be great.
Hi, I'm Bart Geerts. I'm a physician, part-time. I'm still a cardiac anesthetist at the local hospital here, Amsterdam University Medical Center. But I'm also the CEO of a Amsterdam AI startup. We focus on delivering support to physicians, nurses, but also patients by predicting events, really making the administrative load really lower. That's really our goal. One of the tools that we've recently started building is a predictor for infections in hospitals. So if you have surgery, still today here in Europe or any other place, there's about 1 in 4 patients will get an infection after their surgery. So for this country, 1.4 million people get surgery, 1 in 4 gets an infection. And normally, treatment only starts on day 5. What we want is to move the date that we can detect this disease, this complication, and make it earlier, raise a flag on day 0, really, just after surgery. So what we do, we reuse the data that's already in the patient file, we give the prediction, and we try and create some insights why we think this prediction is real. So really try to tap into what the clinician is thinking and the framework they now have in looking at their patients. And then we provide them with some options, some actions that they can take to mitigate that risk and try and prevent this infection from happening.
Brilliant. So one of the things that you'll have come across is the challenge in healthcare of working with incumbent technology providers and, alas, often physicians. And it would be good to explore a bit how people can innovate in that context. Stefan, it'd be great to have an introduction.
Yeah, thank you. So I'm Stefan, I'm the CEO of Fondation Botnar. Fondation Botnar is a relatively new sort of strategic philanthropic organization based in Basel, Switzerland. And we have a very clear mission that we want to be not just grant makers like traditional grant making, but really change makers with a very clear focus on how can we leverage AI and digital solutions for human health and well-being, with a very strong focus on adolescents' health. We have a bias towards low and middle income countries, as we see that these are some of the biggest challenges, given that we have an estimated 18 million healthcare workers shortage by 2030. And we clearly see that AI and associated technologies within an ecosystem of innovation that includes new business models, new financing models, can be truly transformational in terms of bringing health and well-being to many countries across the world. And so one of the partnerships we have, which is this announcement today in the media of the Global Health Initiative of AIDA, where Bill and Melinda Gates Foundation and our foundation are working with AIDA. We are supporting the disease adaptation for East Africa, and in terms of translation, which is Kiswahili, a language spoken by more than 100 million people, and we hope that in the coming years, at least 2 million people in that part are getting access to AIDA in terms of diagnostics. Another one, just the last one, is we just launched less than 10 days ago or 2 weeks ago now. We invested 100 million Swiss francs, about $100 million US, together with the Federal Institute of Technology, ETH Zurich, which is a world leader in the space of digital health and AI, together with the University of Basel, which is a leader in life science, to set up a Botnar Research Center on child health with a very strong focus on AI and digital sort of health-related research.
Brilliant. So I thought it would be good to focus on a few themes that came out of the Intelligent Health Conference. One is about the opportunity. A second is kind of around evidence and how we think of evidence in the context of digital health. And I'd start with the second one, the one around evidence. In healthcare, historically, we worked very hard, or many people worked very hard, to make sure that people weren't taking snake oil. Now, in the digital world, there's all sorts of innovations people are coming up with. It invokes some new challenges, digital, because when you add artificial intelligence, the notion of the gold standard, the thing that we historically would have gone and compared against in a court of law, is no longer the same thing it was yesterday. Maybe start with you, Bart, from the hospital experience. How do you think about evidence in the context of an ever-evolving machine?
Well, first of all, what I see is that there is a certain framework in place today. And the methodology to validate and to take up and trust the new tools by the people that deliver the actual care, it doesn't fit with this new technology. And that actually doesn't only apply to AI. So we have a lot of talk about black boxes and how do I trust this. And I think the issue or the challenge is on both sides. You both have data scientists which basically say, well, this is a good tool, it works, look, statistically, mathematically, it does what it needs to do. But that's not the language of the doctor, of the nurses. They want to see it put to use, tested against the golden standard, whatever that may be, which raises some other issues, like what is the golden standard? Is the doctor really a gold standard? those kinds of issues come up as well. But ultimately,
Of course they're the gold standard.
we need to bridge the gap.
Yeah,
Sorry.
of course they're the gold standard. They're not, I promise. So I guess in that context, historically, there's a challenge there, which is the extent to which artificial intelligence is really that different from regulating regular intelligence. Doctors have historically been regulated by having standards, passing tests, and then having a system of accountability and governance that make sure that they keep to those standards. Is it that different? Can we not just infer that same framework onto artificial intelligence? Why can't we take some of the learning from that?
Well, in a way, it's not different from any biomarker that we use in the lab to test if someone has cancer. I mean, for instance, and I think that's a good example, that if we test for prostate cancer at a GP's office, we use PSA, which is about accurate in 70% of the cases. Still, we use it. I'm quite sure that we can build something intelligent that surpasses that. But now we say, well, it's different. It doesn't have the same result for every patient. There's biases. How does that work? So in a way, it's a regular biomarker, but on the other side, it performs differently with different people from different backgrounds. And that part is still something regulators, doctors, associations have a hard time cracking that nut.
Brilliant.
Yeah.
One of the challenges that comes off the back of any digital health application in the context of the opportunity, I'll ask you this, Stefan, is getting people to purchase digital health applications is quite a complicated process. Geographical idiosyncrasies that make the benefit of artificial intelligence and digital health in its scalability somewhat restricted. What have you seen in the way of innovation of anyone out here who is thinking of applying artificial intelligence to a healthcare application in terms of business models? How should you think about commercializing digital health and artificial intelligence?
Yeah, I think the sort of business models are still sort of in the making. I think an interesting approach is in the US, the company Oscar, which sort of the Google investment arm is recently, has made major investments. And interesting is that Oscar didn't position itself as a digital health company, but it positioned itself first as an insurance company and got actually insurance registration, and then used the data, the driven business model to actually sort of, within. And I would say that this shows that whoever was behind Oscar, in terms of that strategic approach, has a very deep understanding on the complexity of health systems. And so the Uberization within health systems that we've seen in taxi business is not happening so easily because, taxi, those who have traveled around the world, I've worked in 83 countries, taxi business has the same problems most places. It's just, it's not very reliable, it's not very pleasant, and it's relatively easy, to disrupt. Whereas health systems are intrinsically complex by nature. Regulators have the first thing a regulator needs to do is to protect his citizens or her citizens. So I do think, there are issues that needs disruption. There's need for a lot of disruption within health, and digital and AI can bring in this, but it needs to embed it within that broader understanding of health systems. Now, what was exciting at the Intelligence Health Summit in Basel that recently happened about a month ago, that the International Telecoms Union, together with the World Health Organization, have enabled a focus group that is emerging that looks at benchmarking around issues of AI within health. And it is sort of a very early on. They just had on the 25th to the 27th of September, the first focus group discussion, where some of the ideas is that, if like you have a startup company in AI in health, and ministries of health around the world need to have some sort of a way that they can know whether this is a reliable, validated sort of set. And so they're having an idea that the World Health Organization would create some like secret data set, large data sets that are sort of, that should, if you feed them into your algorithm, you basically should have a certain outcome. And through this, basically get a mechanism that you can overcome that challenge of explainability, which a lot of regulators who many of policymakers are in the analog sort of mindset, including, I'm sort of just over 50 and I feel I have a very analog mindset. And I'm co-authoring a paper for the British Medical Journal on the sort of title is around the issue of analog mindsets of policymaker in the age of AI and digital health. And we need to find new solutions to these dynamic environments.
And there's a question that points to around the commercialization of some of this, that the pharma industry has been forced into making generics. How do we think about that kind of issue of dependence on algorithms and proprietary moats? Should we have a human phenome? Should we have algorithmic generics? What's the way of solving that so we don't get vendor lock-in with kind of third-order stickiness because it's learned everything about me and how I tweet, although I don't tweet, alas, very much. So yeah, I'm fine.
That's a very. It would be interesting then to have Hilo from Ada from a commercial side.
It'd be good to hear from you.
But I think we've sort of looked at it as our foundation, and we see that in the next 20 to 30 years, the convergence of three technologies in terms of massive amount of data from social media wearables, clinical data, genomics, phenotyping, etc. Massive explosion of that data with environmental data, then increasingly powerful algorithms, and then as well, computing power increasingly. This means in the next 20 to 30 years, we'll create an unprecedented situation in human history of deepening the understanding of human well-being and health. However, AI is incredibly data hungry. And if we look at the data governance globally at the moment, we basically have sort of three emerging models. We have the sort of looking at health data as a commodity that is locked in and commercialized and sold. I would call that the commercial model. Then there is an emerging model of data cooperatives where I myself as a citizen can decide what to happen and who can use this data and who cannot use my data. We think that to really unleash the power of AI and these three convergent technologies, we should call collectively that health data should become a global public good. That the business models are not in terms of the commoditization of the data, but actually in the intelligence of making use of this data. But this is early days, but it is a journey that we sort of hopefully collectively can work on.
So Hila, you were going to add to that?
Yeah, absolutely. I think it all ties into each other, starting from the commercialization to then also talking about the use of data. I think I'll go a step back because I think you were mentioning before that sort of who's paying for these type of apps, and is it the consumer at the end of the day? And just from our perspective, it is really that we say it's not the consumer, because the right to it's a fundamental human right to have access to the right diagnosis, and therefore, sort of in terms of commercialization, we work much more with payers and health systems. So insurances, for instance, in high-income countries that have a specific interest also for the well-being and health of the people that they have insured, and to find more pathways that these insurances and the payers in that sense pay for the use of these services. So in our case, for instance, with the 5 million users that we have now, it's completely for free. So you can download the app for free, and that's why also the distribution is also so high, and also in low-income countries. And in terms of the data, I think that's tied to that. So the first model that you were mentioning of selling data, I think that's kind of outdated. I would say this is not the future. It's much more about citizens being also empowered, knowing how their data is used, and also with GDPR now in place, sort of people really also having the awareness that they own their data, but if they would like to, for instance, make their anonymized data available for research, or for instance, as a global good, to share aggregated data with institutions like WHO or government, to use this effectively for analyzing public health needs or controlling outbreaks, I think that's where we can see the real power of using these aggregated insights.
Where do you guys see the balance of the pharma companies, the big tech companies, the big providers in the innovation currently happening in healthcare and artificial intelligence? Maybe just a quick finish off on that from each of you. Start with you, Bart.
I think the field is so complex that I wouldn't know. I mean, I really believe that patients own their own data, and from that we actually can leverage tools and we can build on a model that how people get paid for their services. But I don't see anyone owning that process. Sorry to go back to the last question a bit more, but I don't see government stepping in and providing us with something. So I really now don't see who's going to be in charge of that process. So I think who owns the most data for now still will be a winner of sorts.
Yeah. Yeah. Stefan?
Well, I think a good example is the new CEO of Novartis was. I mean, it's worth looking at him, and he tries to basically change the culture in a pharmaceutical company and wants to see more as a software company, and they really see the value of sort of data-driven health outcomes. And I don't want to put that into in his mouth, but we basically don't have healthcare systems in most places. Definitely not in Europe and the US. We have disease treatment systems. We don't have health and well-being systems, and the incentives are structured in a way that you're not getting the benefits if you are actually healthy and well. And so there needs to be the incentives change, and given that with AI and big data analytics, it gives us a new opportunity to actually have pharmaceutical companies that actually can invest into keeping people healthy and use life science to actually not getting sick in the first place. Wouldn't that be really what we want to have? Why you have business models that you only can have revenue generated when you're feeling sick? Why not having business models that actually, if it helps you to stay well and healthy, to keep that way? So,
really, do you just want to finish off and then we'll go to questions?
Yes, absolutely. I think it is kind of in the making, the whole process of how do these stakeholders come together. And I think there is an argument to say that also players that own a lot of data will probably shape the discussion around how this is used effectively. But I truly believe it's a multilateral effort, and it's yet to be defined.
New frontier. There we go.
I think the pricing is a really good argument. Yeah. That's driving the whole process now.
Brilliant. So we've got a bit of time, I think, for questions. If anyone has any questions, health AI-related questions in the audience. Looks like there's one over here. Could you just let us know who the question's for as well?
Yeah, the question is for Bart, Dr. Bart. Thanks for the nice discussion. You said that the fact that AI technology works differently on different people is problematic for the industry to accept AI, but that's a big problem, right? Because that's the whole point of personalization.
Exactly.
So how are we going to fix that?
I think we need to develop new framework, and it needs to be accepted by the physicians. So how do we do that? I think now we use current framework. We test it in an environment that we're used to, randomized controlled trials, that kind of setting. And ultimately, we need to build towards something that's acceptable and continuous. In a way, AI enables us to do continuous trials in that person in front of you. Do I have an answer to that? Not yet, but let's hope in a couple of years we can actually have a solid answer on that.
Yeah, I mean, and from a regulatory perspective, I guess before the randomized control trial, I think the first one was in like 1952 or something. Then there was meta-analysis, loads of methods that were developed to evaluate medical interventions, and it just feels like it's a problem to be solved and exciting, if you like, regulation, new methodologies. Brilliant. Any other questions? A question over here.
Hello. My question is, if we commercialize diagnostics, how would I know that in time, the health app would not suggest me a treatment that's beneficial for the company, the same way as Facebook, for example, will suggest me an ad which is beneficial for them? Thank you.
Yeah. I think here sort of what we work towards is full transparency. So let's say more looking into a general advice, what type of medication, but not saying this is the product, for instance, when we show sort of what the possible next step for a certain condition could be. And I think ultimately, this is the key way forward to build trust, because at the end of the day, patients are trusting us with their data and to provide them with some guidance. And I do really think here that the defining element is when we work with other stakeholders that sort of that provide treatment, that we make always very, very transparent and clear to the user what information is displayed to them and by whom.
Brilliant. I think, unfortunately, we've run out of time, but I'd just like to thank the panelists for joining us today.